Thank you. That's even before you heard what I've got to say, so that's good. There won't be any claps later. Thank you, everybody, for spending Sunday afternoon listening to a talk instead of enjoying the burgers out there. And thank you to plant-based health professionals and to Dr. Kassam and to the organizers to give me a chance to talk to you all. I'm going to try and share some of the information that I have gathered over my 30-year career in obstetrics and gynecology. I'm a consultant in London, focusing on all aspects of gynecology, and just recently I've given up obstetrics, which means I don't have to rush in the middle of the night to deliver babies that are not wanting to come out. I'm very happy to take questions afterwards and outside. But what I want to just bring to everybody's attention is that we know that we often think that if we just take a tablet, we're going to get better for some of the conditions. And sometimes it does work. If you have a headache, sometimes just taking a tablet may make it go away, but you actually then haven't really looked at the cause of the headache. So what I have found over the years is that when we look at health and well-being, it's not just one aspect that really makes a difference. And so we're going to go around looking at various things. We all know that exercise is good, and it's not that controversial. Everybody will agree that if you move, and you move naturally, and you walk to work, or you run up the stairs, these things are good for us. Some extra amounts of exercise is even better, we know, for overall health. We also know that we benefit when we are in the sunlight. We enjoy, we feel happy, we feel good. And again, nobody would argue other than saying put on some sunscreen after the first 20, 30 minutes of exposing yourself to sun to get your vitamin D to prevent skin cancer. Almost everybody will agree about sunlight. We also know that stress can actually, and especially recently, we've been looking more and more into this because we realize that stress can be a trigger for many conditions, skin conditions, heart conditions, cancer. We can't quantify it, but we certainly know that it's a factor. And just logically, we know that a happy life tends to be more stress-free, and as a result, probably more ill health-free. What we also know is that the environment makes a difference. So if you're living right in the middle of the center of town where there are a lot of buses and cars going, so pollution, your work environment, if you're sitting all the time, maybe a standing desk, all these things can actually make a difference to overall health. If you live out in the countryside, breathe fresh air, walk your dog, you're probably going to have a slightly better quality of life than if you're breathing in fumes all day. So we also know sleep. Now, I think all generations are now short of sleep. You will have people, all of us are guilty of this, looking at our phones just before you go to bed, looking at our phones as soon as we wake up. And that can affect the amount of melatonin that is needed for you to have a good quality sleep. And so we know that if sleep is disturbed, you are grumpy the next day, but that's just one aspect of it. There are a lot of other hormones that get affected when you don't get good sleep. And infections can also play a big role in how you feel, and this could be very mild infections that you may not even know about, that can affect your heart health, it can affect your overall health. Your gum disease, for example, can also contribute to heart disease. But we can treat infections if we know that there are one, and that's one of the big advantages of Western medicine. But we also know that things like smoking, alcohol, they have detrimental effects to our health. And most of us will now agree that there is no safe limit for alcohol, and that when we drink it because we just want to be part of a social situation rather than actually drinking just because it's good for health. And I hope that message is getting out loud and clear. So what do you think is the next big thing? So we know that movement and exercise and stress and sleep is good, but one of the things that really evokes a lot of emotions, what do you think that is? Yes. So, is it working? So it is diet. Diet really plays a big, big role, probably the biggest role. And the way I like to put it in the words of some wise lifestyle medicine physicians is that people often say, oh, you know, my grandmother had diabetes, my mother had polycystic ovarian syndrome, somebody else had, my grandfather had heart disease. Well, genetics only contributes to about 5 to 10%. It only loads the gun. It's lifestyle that actually pulls the trigger. And diet is the biggest factor that actually works in your diet, in your favor or against your favor. And so these are very powerful words. We take the Hippocratic Oath, you know, as doctors, but we actually don't follow what he said. And he said this 2,000 years ago, that let medicine, food be your medicine, and let medicine be your food. And we have somehow wandered away from this and actually not realized how important this simple statement is. And it can be the slowest form of poison or the safest form of medicine for us. And how do we know this? Why do we keep on banging on about, you know, whole food plant-based diet, you know, not just here in a vegan festival, but also outside now, because we are a growing number of professionals who have realized that actually food can make a big difference. But this is nothing new. This has been around for thousands of years, and we know that from observational studies. What are observational studies? These are the blue zones, the 5 areas where we know that these are documented people. We have documentation that these people live till 100, 110 without actually dying from any major illness. And so these are the blue zones. They're in Japan, in Okinawa. They are in Sardinia, in Italy. We all know Italians love their food. We know there's a small place in Costa Rica, in Nicoya, in Greece, and the Seventh-day Adventists in Loma Linda. These are people who all seem to have, even though they are spread out all over the world, they have something very common. 95 to 98% of their diet, can you imagine, 95 to 98% of their diet comes from whole plant foods, mainly starches. And what are starches? Starches are basically carbohydrates that release their sugar very, very slowly. And so you will, whether you are in Okinawa, where you eat rice and beans, or whether you're in Italy and you eat pasta and beans, or you are in Costa Rica, where you eat corn and beans, it's the same slant, okay? These are starches. These are beans and whole grains. So essentially 95 to 98% with very occasional festival occasion type of eating of meat and a little bit of fish. So we know that we already have the evidence from observational studies. So you can't just discount it. You can't just say, oh, my grandmother smoked till 100 years of age, and so, you know, it's fine to smoke. You can't take one person and look at them as to how healthy they are or how unhealthy they are. You've got to look at a whole population. And that's what the blue zones do. They look at a population to tell us what are they doing right, that we can actually watch them and observe them. They of course do other things. They all walk, they all have gardening, they all, you know, have community, they have a purpose in life called ikigai, but their diet tends to be a whole food plant-based diet. We also, I'm not going to go into studies because that can be really boring for the lay public, but there are plenty of studies, and any of you who want to either contact me directly or go online, you will find study after study after study confirming what we're talking about is that the more unprocessed foods that you eat that are close to the ground, that come from plants, the longer, not just the longer you live. Nobody just wants to live longer. You just hopefully will not spend the last 20 years of your life, you know, having somebody wiping you and looking after you. And even as a young person, you know, you're not going to worry too much about fertility, about your skin, about your hair, about your weight. So it's not just about the fear of dying. It's also, as Dr. Ornish says, the joy of living. It's actually enjoying your time now. That's really important. And one thing you have to be very, very aware of all, so there are randomized trials like Dr. Gemma Newman showed about how you can reverse heart disease and diabetes. There are cohort studies, the nurses study that just watched 79,000 nurses. They've just followed them very closely, and they found that for every 2 hours that the nurse sat, she or he increased their risk of getting overweight by 25%. So we know that these are, lots and lots of studies are there. But you have to also remember, for every one good study, there are 10 or 20 studies which are sponsored. And so they get drowned out, and you can't actually hear the real truth because of the noise that is there from the sponsored studies. And the reason I'm going on to all this initially is because you have to understand that women's health doesn't come just on its own. It is, women are the cornerstone of all communities, yes? The woman decides what's eaten at home, the woman decides what her children are going to eat, the woman decides what her husband's going to eat, or her partner is going to eat, and women talk. We talk a lot, and it's great because we talk a lot, so we share information. So it's important to understand why we are reaching this conclusion that for good women's health, you need to eat well, you need to move well, you need to sleep well, you need to stress less. So these are, again, two very important recent advances where about 30 scientists, or a little bit more than 30 scientists, actually met for deciding what is the food that we need to be eating as a population if we want to reduce global hunger, if we want to have a planet that we want to leave for our children or our grandchildren, because that day is coming very soon where we are actually going to be asked very serious questions by young teenagers as to why have you left us this world that we can't actually live on anymore. And the Canada Plate also tells us something very, very important. For the first time, a country has been bold enough to say, you don't need to have dairy, you don't need to have meat as part of a healthy diet. In fact, you would probably thrive much, much better without having those ingredients in your diet. And that's a big thing, considering how much of pressure is there on any government to actually succumb and put these products on the plates so that they are not in power the next time. You understand? These are all political decisions. Does everybody know the difference between what being a vegan is and a whole food plant-based person? Yes? Okay. Well, if you do, okay, that is no. So veganism is an ideology, okay? So you just believe in one thing. You do not exploit anybody else. You don't exploit a human and you don't exploit animals. That's it, end of. As a result of that, vegans do not eat animal-based products. They don't, and that includes meat, dairy, you don't use any animal-derived products, you don't wear leather, you don't wear silk, you don't wear fur, you essentially don't endorse animal exploitation. However, being vegan is just the start. It's not a perfect state, and so you only try to improve when you're trying to be vegan, because at the end of the day, we live in the real world, and there are probably things that we do knowingly or unknowingly, which can cause harm. What we can make a decision, especially, is with the food that we eat, because that's a decision that you actually make yourself as to what goes onto your plate. A whole food plant-based person, however, tends to be somebody who's eating whole plant foods for health. So they're avoiding animal foods because it's been shown over and over again there are no health benefits to be got from eating animal products. So they also, at the same time, limit oils. They will also try to reduce the amount of salt and sugar in their diet. However, the happiest situation would be to be a whole food plant-based vegan. Okay? Why is that? Because as a vegan, you've decided that you want to do something for a cause. You want to try and convince other people, your friends, your family, about avoiding exploitation of animals. Now, if you look the part, if you are somebody who is healthy, if you are somebody who glows, people are going to ask you, what are you doing? People are interested in that. I know it sounds superficial, but if the aim of your game is that you want more people to come on board and to stay vegan, you want to encourage good health, because good health, being a whole food plant-based vegan means that you're kind to your own health, you're kind to the planet, and you're kind to animals. So this way, it's a win-win situation for all. You don't have to be, but it does help if you are eating the right food so that you feel healthy and you feel a lot of energy. And why does it matter? In women's health, so we're not going to talk about heart disease and diabetes and all the things that have been very, very eloquently described over the last 2 days. But there are a lot of female conditions that actually benefit hugely from eating the right sort of foods, by leading the right sort of lifestyle. Polycystic ovarian syndrome, we will be talking a little bit more about that. Endometriosis, I'll explain what that is. Painful and heavy periods, most of us will identify with that. men, including in the room, because they would often have partners who may be suffering from it. Fertility, and fertility can affect both men and women. A third of men will suffer from fertility issues, a third of women in the group that suffer from fertility issues, and sometimes both the partners will have issues. So all these can be addressed to quite a large extent through lifestyle. Not just food, but other things. Menopause, hugely important for us because many women don't want to take hormone replacement. Many women want to do things naturally, and just because you take a hormone replacement does not mean that you should not be doing other things that will actually improve your health overall and will reduce your risks of heart disease, cancer, especially breast cancer, because we know that now that 1 in 8 to 1 in 12 of us will actually get a diagnosis of breast cancer in our lifetime. So, depression, there was a question before about whether mental health can be affected, and it can, and I see this all the time in women with polycystic ovarian syndrome, where depression is a known symptom, and just changing the way they eat actually improves their mood. And we'll talk about that again under polycystic ovarian syndrome. Weight management. Most women spend most of their lives yo-yo dieting, and I think it's and men nowadays too. And I think what is really important is to be finding a way of eating where actually you do not have to worry about calories. You do not have to worry about what's going on your plate. You can eat until you're full and then just know and look forward to eating the next meal. Cancers of the breast, womb, and ovary, these are all women's health concerns. Men can also get breast cancer, and I always advise men to be very aware of their body. Acne and thrush, which can really knock a person's confidence, men and women. Osteoporosis, which we've already had discussion this morning. My husband Rajiv spoke very nicely about what you can do to help yourself. And autoimmune conditions, which can also affect women. However, I'm not going to discuss eczema, lichen, lupus, and all the other general conditions that affect both men and women, because my topic is very specific, women's health. However, it's so vast that it actually needs a whole day. So we'll be talking a little bit in more detail. So people often say, you know, it's all very well for you to say whole food, plant-based, vegan, non-vegan. What should we be eating? So does somebody want to shout out what they should eat?
Legumes.
Very good. So a diet rich in fiber, yes? So legumes are very rich in fiber, and so that's a very good thing. Anything else before I start putting it up? What is a whole food plant-based diet? What should we eat? There are only 5 real groups. So fruit, yes? Vegetables, lots of vegetables, especially green vegetables, okay? Green vegetables have this nitrites, which when they go in, they get converted by the gut bacteria and they get released in the lining of for your arteries and releases nitric oxide, which dilates your blood vessels. So we need lots of vegetables, especially green vegetables. Whole grains, yes? Everybody likes whole grains. What does whole grains actually mean? So wheat flour is not a whole grain. It is a grain, but it has been processed. So the more grains that you can eat that are closer to the original form, the better they are. Okay, so whether it's groats, which is the great-grandmother of porridge oats, whether it is wild rice, black rice, whether it is quinoa, whether it is millet or spelt or barley, you should be looking to eat whole grains. And remember what I said, starches. So whole grains are starches. They are sugars that are released, they're complexly bound and then slowly get released into the bloodstream, so reducing your risk of diabetes and things. Beans. Beans are the same. Beans, legumes, peas, lentils, all these are groups that actually are the cornerstone of blue zones. So the more starches you eat, the better you will feel. Under whole grains and beans, I also want to mention other starches which most women are scared of. Potatoes. Eat potatoes, eat your body weight in potatoes. You are not going to get overweight. The problem with potatoes and sweet potatoes and things is people tend to fry them, they tend to chip them, they tend to put oil on them, they tend to put butter on them, they tend to put cream cheese on them. That does not help. So remember that the more you eat of potatoes, sweet potatoes, whole grains, beans, fruits, vegetables, and the forgotten 5th one, herbs and spices. Every time you put a handful of coriander or parsley or basil or a pinch of turmeric or ginger or garlic, you will boost the antioxidant power of any of your dishes by 200%. And you understand what that basically means, that instead of eating a whole bowl of, say, rocket leaves, you add some basil to it, you are then going to increase the power of reducing the free radicals, which are all these dangerous molecules that are floating around in your body, which you don't need excess of, because with the stress, with the pollution, you can have more free radicals. So you want to eat the right foods that actually absorb these free radicals and neutralize them. Seeds and nuts. Now remember, seeds and nuts have to be eaten in a small amount. Why? Because of the fact that nature has put them intentionally in a shell. Okay, so before you would have to sit down over Christmas and crack open a walnut and then eat it. So it's very easy to eat large handfuls of nuts, and all you want to do is you want to eat a small handful of nuts. So put them on your salad, put them on a savory dish and enjoy them rather than eating them in big handfuls. It's very easy. I can sit with a whole bag of nuts in the car, and by the time I've reached my one workplace to the other, is gone. So it's just important to remember that, yes, they are very healthy, but you want to eat them mindfully. We are not squirrels. We don't have to live on only nuts, so we should eat the rest of the other things. Again, try to shop in your local markets. Try to shop in a supermarket as it's closing, because then a packet of beans that may have been £2 will become 10 pence in the fresh produce. So you just want to buy things that are local, which are fresh, and you can freeze in bulk in season if you are able to buy in the farmer's market. And if you are able to afford some organic foods, then try to buy grapes and potatoes and things that are better off. They're known as a dirty dozen. So you want to try and buy foods that are organic when you can afford them, and if you can't, then at least pick and choose the ones that you want to, apples and grapes and cherries and things like that. There are lots of different types of plates. I'm not going to focus on this just now. What should we not eat or avoid? Come on, keep shouting out, because we're not going to reach the women's health.
Oil.
Yes, very good. Oil is very good. So foods without fiber. Animal products. Okay.
Dairy.
Yes, dairy. Juices. Because what happens is the fructose gets separated out of the fiber and then causes insulin resistance. And as a result of that, polycystic ovarian syndrome can get worse. Oils, we talked about, and junk and highly processed food. So not your friends. The benefits are much more, so not just from the health point, but also there's no calorie counting, better mood and sleep. You address the nutritional deficiencies. It can be cheaper if you shop correctly, less plastic waste, much kinder, and a much better world for our future generations, and absolutely reducing this awful, awful animal suffering that we see all around us. We're just going to go through some myths. Does being overweight increase my risk of womb cancer? Just shout yes, no, and we'll just, okay. Are heavy periods normal? No. They're not abnormal always, but they're not normal. A high animal protein is good for polycystic ovarian syndrome? No, but people do that. They do eat a low-carb paleo-type diet for polycystic ovarian syndrome and reduce their insulin resistance, and then find that their polycystic ovarian syndrome gets much worse. Cervical cancer is caused by a viral infection? Yes, very good. Very intelligent crowd. There is no safe limit for alcohol consumption? Yes. Genetics or lifestyle is important for breast, ovarian, and womb cancer? Okay. Chlamydia increases my chance of getting an ectopic pregnancy? Yeah. So lifestyle is not just about food. It's also about how you conduct your life in the rest of, in various situations. And you just remember, if you're not protected just even the once, you just have to be with one partner, and they may have had another partner, and so you don't have to have slept with many people to actually get infections. You just have to protect yourself at every point to think, what can I do to reduce my own risk of pelvic pain and infections later? Diet and lifestyle play an important role in fertility? Yes. Okay. Exercise is a good way to lose weight? No. We'll come back to that some other time if I have time. Very bad way. You've got to climb how many floors of the Empire State Building to work off 3 Oreo biscuits? 72 floors, okay? Yes. So the first question, obesity. Now, obesity is a real problem for PCOS as well as for heart disease, of course, but also for breast cancer. And 1/3 of women are overweight and 1/3 of women are obese. And actually, children are now reaching that same sort of statistics. And it is quite astonishing that 2 out of 5 women in the UK don't eat any fruit at all. And many of them are slim women because they are often told that fruit has got sugar. Well, fruit has got sugar, but it also has fiber. Alcohol is another reason for putting on weight, and so you have to be very mindful. And for every 3 drinks that you have, 3 units that you have in a week, you increase your risk of breast cancer by 15%. Polycystic ovarian syndrome is a very common condition. It's basically a condition where the ovaries get confused. They get confused signals from the brain, and they get confused signals from the ovaries themselves and produce a lot of excess male hormones. And as a result, they can have a wide spectrum of symptoms. How am I doing for time?
25 minutes.
Okay. Endocrine disorder, it's an endocrine disorder of the wide spectrum. So not everybody will have the same symptoms, okay? And so here you can see these are ovaries that are larger than they should be, and they have this sort of shiny appearance. And that's because of these empty egg follicles that you can see arranged in the shape of a pearl necklace. So it's known as actually a rosette form or a pearl necklace arrangement of these empty egg follicles, because the brain that is supposed to send the messages through its hormones is not actually sending the message to the ovary, which has got confused and starts producing excess male hormone. And as a result, some women may find they have increased hair growth, increased facial hair, male baldness, male pattern baldness as well. So you can see a normal ovary actually looks nice and small, and not too small, because then that suggests that you are heading towards the end of menopause. And menopause essentially is when you're already born with the number of eggs at birth, and so about 300 of those will get used during periods, but essentially when all the eggs get spent, that's when menopause occurs. So that's important to understand. So sometimes menopause may occur very early, like in my case I had early menopause at 38, or the common age is about 51. So it's the PCOS condition, as you can see, genetics plays a role, but lifestyle and environment has a huge impact. And as a result of this, it increases your insulin levels, and increased insulin will then have an effect on all the various hormones like Dr. Newman mentioned, and resulting in increased testosterone, increased estrogen, which leads to all the clinical symptoms. And these are some of the symptoms: missed periods, acne, increased facial body hair. But what often people don't realize is that depression and anxiety and not being able to sleep very well, insomnia, can actually be features of PCOS. And often doctors will say, no, that's got nothing to do with your polycystic ovarian syndrome. And when they actually get better with changing their diet, they find that many of these symptoms improve hugely. However, pain is not a feature of PCOS. That is important to understand. Women often think, oh, I've got polycystic ovarian syndrome, I must be having pain. That is usually another feature. Either your periods are painful or you have an ovarian cyst of some other type. So what is the key? Back again to the same thing. Okay, it's a whole plant food diet. So the more beans you eat, the more whole grains you eat, the more fruits you eat, the more vegetables you eat, the more you exercise, all these things will improve insulin sensitivity, reduce your insulin resistance. Avoiding smoking and alcohol also helps. There are a lot of studies, and a very good study, a randomized trial last year, showed that women who ate more soy tended to do much better when compared to when they were on an animal protein diet. For polycystic ovarian syndrome, you want to reduce stress, you want to ensure good quality sleep, and there are various methods of stress management, and you just have to find one that suits you. But it is important that you don't ignore this and think that this is just for, the hippies. It actually makes a big difference. Whether somebody is trying to prevent cancer, whether you're trying to reduce your risk of polycystic ovarian syndrome, meditation, yoga, regular exercise, psychotherapy, all these things help. Try to get 7 to 9 hours of good quality sleep. And I mean this for the men as well in the room, because it is important that sleep is a time when your cell repair occurs, when actually all your cells decide to go and get healed again so they can start the next day. And try to have screen-free time. Exercise helps. Try to work out whether it is that you should work out in the evening or in the daytime for a good night's sleep, and figure it out for yourself. Why is it so important, however? You know, what is the problem if you have polycystic ovarian syndrome? So not only can you get acne and depression and sleep problems and irregular periods and weight issues, but also you can have fertility problems. You can also have diabetes in pregnancy. You can develop type 2 diabetes. The only group of women who get womb cancer under the age of 35 are women with polycystic ovarian syndrome. Half the women with PCOS are overweight, the other half are slim, but you can be slim and vegan and have just a diet of crisps and Coke, and that will give you polycystic ovarian syndrome if you have a genetic tendency. So it's important to understand there are a lot of side effects or long-term effects from having this condition. So we will leave PCOS aside, and now we'll look at painful periods. And again, there are lots of things you can do. Of course, you can go and take tablets, but there are things that you can do to help yourself. Yoga, hot water bottles, eating a whole food plant-based diet, exercise, avoiding coffee. All these things will help to keep period pains down. Heavy periods, same thing. Anemia is a real problem. And so if you want to make sure that you're not anemic, you're not losing, you're not having extremely heavy periods and not combating it with medication, which you should if you are in a situation where you're becoming anemic, you also need to supplement it by eating the right sort of nuts, the right sort of legumes, the right sort of beans, the right sort of fruits. But there are lots of things that one can do medically as well. So I'm a doctor who likes to believe that there is a meeting point for both Western medicine and natural medicine, because you can't do one without the other. So while you're helping yourself with your diabetes, what you can do is try to reverse it through eating the right foods. But while you're doing that, you may need help with medications. The same thing with gynecological conditions. Do not completely avoid something just because it happens to be a tablet or an injection. You just have to be very sensible about it and know what works for you. And ask the right questions. Nobody loves your body as much as you do. So don't expect your doctor to always give you the right advice. You have to ask all the right questions. Be informed so that you know what you're asking about. There are medical conditions that affect periods, pain, and fertility. And we know endometriosis is a condition which basically, if this is a normal, this is a laparoscopy where this is the uterus, these are the ovaries, this is a lovely clean pelvis. However, this you can see is completely scarred. And the reason it's scarred is every month when you have a period, what happens is the blood comes out also through the fallopian tubes and can stick itself in genetically susceptible women. And cause scarring and pain and ovarian cysts and reduces fertility and can actually make you a cripple. You look all right from outside, but from the inside you're actually suffering with pain and nobody understands at work. So there are medications and drugs that we can use. However, what is also important to understand is that having a high animal protein diet actually makes a big difference to the amount of endometriosis that is diagnosed and is caused. So we know by just cutting meat and dairy out of your diet, you can make quite a significant difference with endometriosis, and there are studies to show that. There are other conditions like fibroids and polyps. These are all conditions that can actually affect us, and so it is. And they're all estrogen related. So if you're overweight, you're more likely to have polyps, you're more likely to have womb cancer, you're more likely to have breast cancer, you're more likely to have polycystic ovarian syndrome, you're more likely to have conditions that are estrogen related. So keeping your weight down by eating whole plant foods, again, goes a long way. Again, I'm not going to talk about detailed studies, but the nurses study, the Physicians Committee of Responsible Medicine have very good studies on endometriosis. Green tea has been shown to affect the size of fibroids, but some fibroids need to be surgically managed. Most fibroids don't. And again, you have to see a specialist so that we can then help you decide whether you are somebody who needs to be just managed conservatively or you need surgery. When a couple can't get pregnant, despite having regular unprotected sex, we say that they have got subfertility. This is increasing rapidly in the UK and all over the world. It now affects 1 in 7 couples. And however, the good news is that most women will get pregnant within a year of trying. About 94 will get pregnant, 94 out of 100 couples will get pregnant within 3 years of trying. But subfertility is becoming a problem because of the conditions that I told you about: polycystic ovarian syndrome, endometriosis, sexually transmitted infections. Primary infertility is where you have had no previous pregnancies. Secondary infertility is when you've had 1 or more pregnancies, even though it may have failed. If you may have had a miscarriage, but it's still counted as a pregnancy. It could be a male subfertility or a female subfertility or unexplained subfertility. This is a whole different topic, but if you're not pregnant within 6 months after the age of 35, or if you're not pregnant within a year, if you're under 35, or if you don't have a medical condition, then I would recommend seeking advice sooner rather than later. Again, push for these tests rather than just waiting if you are worried that you may have had a risk factor like a sexually transmitted infection in the past. Don't ignore it. Top tips for improving. So everybody's worried about their biological clock, so try to plan ahead. If you do want a family, regular sexual intercourse is important. Adopting a whole food plant-based way of eating. The number of patients I get now who started their periods after not having had periods for 2 years, after changing their diet. I've had patients telling me that they've fallen pregnant, which is really lovely to see and lovely to hear. And it's important that you can actually make a difference. You don't have to listen to the medical doctors who say there is no chance for you. You know, there is always hope. Nobody can say nothing that can be done until really there can be nothing that can be done. Lifestyle, so make sure that you exercise in the right amounts. Try to avoid being overweight. Try to avoid, if you know somebody who's got an eating disorder, warn them that this may have an impact on their fertility so that they can then seek help. So be a good friend in a non-judgmental way. Alcohol, avoiding alcohol, smoking, stress, all these things will help in improving pregnancy rates. Safe sex is really important so that you avoid infections. Seek advice if you're worried about medical conditions. And a similar advice for men, including for men especially, making sure that they wear loose underclothes and avoid very hot showers, but also avoiding smoking, alcohol, and eating a whole food plant-based diet. Vegan pregnancy is safe. Vegan breastfeeding is completely safe, and there are studies to show, and I won't go into the detail of the studies, but basically birth weight and preeclampsia rates and all were really low. Preeclampsia, which is high blood pressure during pregnancy, was really low in groups that had a vegan diet. What about vaccines and contraception? So because many of these contraceptives are not vegan, people get very worried. If you are following, you are being vegan, for example, I don't wear leather or silk, and so in that sort of situation, you will worry about whether some of these drugs have been tested on animals. Do they contain dairy products, lactose and things? So sometimes you have to remember that being vegan is about doing the least amount of harm. So if having an unwanted pregnancy is going to bring you a lot of stress, so doing a natural method of contraception, if you're not in a stable relationship, becomes very anxiety-provoking for women. In that sort of situation, having an unwanted pregnancy, then a termination, or a child that you don't want really in the world, adding to the burden of the population, then you do have to be somebody who has to think, maybe the pill or the implant or the coil is the right thing for me. So again, lots of discussion about, this is a whole different topic. Double protection means that using something very effective, such as the pill or the coil, as well as condoms, and again, avoiding condoms that contain, often they have casein, which is a dairy product in condoms, so you can actually get vegan condoms. Infections, if you do get infections and it's better to take antibiotics. Some of them may have been tested in the past, and yes, we don't want that to continue to happen, but while we are striving to make animal experimenting and testing completely banned, what you do have to do is be sensible when it comes to being treated for an infection. Otherwise, you end up in a hospital and use much more resources and much more non-vegan products. Blocked tubes caused often by chlamydia, silent infection, ectopic pregnancy is a result of that, where you can see a pregnancy in the wrong place. So instead of being in the uterus, it goes into the tube, and so you want to make sure that you don't put yourself in that sort of situation. All these are type 1 carcinogens, and so it's important to try and avoid. The menopause, loads of symptoms, all of which actually can be helped hugely from a whole food plant-based way of eating, sleeping well, regular exercise, meditation, and also sharing it and talking about it and looking at it as a release rather than thinking of it as the end of your life. And if you do need to have HRT, then it's worth thinking about it because quality of life is really important. This is one of the dishes that my daughter had made. It's amazing. All these dishes are so flavorsome. There's no reason why one should not enjoy various foods on a whole food plant-based diet. Soy, I think, has been touched on a few times, but really the only one thing I have to say, if you have breast cancer, eat soy. If you don't have breast cancer, eat soy. If you have prostate cancer, you eat soy. If you don't have prostate cancer, you eat soy. If you have polycystic ovarian syndrome, you eat soy. If you don't have PCOS, you eat soy. You basically eat soy and all the other products. Soy has just been given this elevated status, but basically phytoestrogens, which are the good estrogens that prevent the bad estrogens from dairy and all, blocking them, they are present in a lot of foods. Flax seeds especially are the highest content. This, I think, again, Dr. Gemma Newman just talked about, but I just would like to reiterate this. Taking vitamin B12, vitamin D3, if you're not able to get enough sunlight, because all food sources, including fish and eggs, they all are very poor sources of vitamin D. Sunlight is your friend. Okay? Omega-3 from walnuts, chia seeds, and flax seeds, but if you're pregnant, remember, you need to take supplements. You need to take folic acid. If you're planning a pregnancy or are pregnant, you need to take omega-3, you need to take B12. Okay, B12, vitamin D, folate of 400 microgram, and algae-derived omega-3. High quality supplement, which is vegan, you should opt for. All this, if you want information, you can either DM me via Instagram, and I can send you my entire notes for my patients that I use. Useful resources, again, we've all talked about it. I would strongly advise you to watch some of the movies so that you can actually empower yourself, because unless you get compassion, you won't stick to any sort of lifestyle. You can eat any amount of whole plant foods. Somebody shows you a bacon strip or a bacon burger, you might then slip. However, once you know the suffering that's gone into it, you're not going to. So make yourself compassionate, and you will be compassionate to yourself as well. So diet rich in beans and fruits and veggies. I won't go into my vegan journey, but this is what I tend to eat, a lot of food, okay? And this is the circle of wellness. And remember that it's not just one thing. You want to have good sleep, good exercise, the best diet ever. You want to have lots of friends and a lot of life purpose, and do a lot of charity, and close the circle of compassion for yourself as well as for all the animals around us. And I run a project which is voluntary called Women for Women's Health, going to inner city schools, and just to show them, they don't even know what beans are. So sometimes it really is one of the best things I find that I can do to, I love my job, but I also love what I do with regards to empowering women.